we read in papers, so many people died in a road accident or some tunnel collapse or somebody got washed away. They become mere statistics. But when one mother dies, she's not statistics anymore. It's tragedy. Saving mothers' lives is probably what I've been fighting for all these 45 years of my life, Then let us all understand, as grandparents or aunties and uncles, we are nurturing a future generation which is going to be, single.
Hello everyone, I am Dr. Shweta Jain. I welcome you for the podcast episode of Surya Mother and Child Care Hospital. Pregnancy is a wonderful journey for each individual, but at times for a few women it becomes a high risk pregnancy for which a constant monitoring, specialized care and timely intervention is required by some experts. Our gynecological experts are always here to help you for that. I am here to welcome our very senior and extremely experienced Dr. J.P. Rath sir with me today to answer some questions regarding high-risk pregnancies and clear the myths and facts regarding the same. Welcoming you, sir.
Hello.
To the Surya Hospital Department. Very glad to have you on board.
Thank you very much. Good afternoon to you and good afternoon to all the people who are going to be watching this. I like the word that you used as experience. Expertise is something that comes with age, definitely, but we are never experts. And now, like you said, that is a long road. All roads can have bumps, they can have potholes. So when to expect, when to circumnavigate is what I'm going to talk about.
Glad to hear that, sir. So we'll start with, because you started with experience. So very commonly what we see right now, that people come to your OPD and they start with, हमारे ज़माने में तो ऐसा high risk का कुछ नहीं था. All the patients are saying कि my mother-in-law or grandmother for that matter did not have any such critical care to be done. Why at this stage you are saying कि अभी क्यों इतना high risk बता रहे हो? Do you think over the years you have seen any difference in women going through pregnancy? What has changed according to you?
This is a generational thing. This has occurred in every facet of life. A man was using a cycle 40, 50 years ago, moved on to a two-wheeler, moved on to a smaller car. I yet remember the first car launched in India was just 30,000 rupees. Now has moved up to 30 lakhs. So this evolvement has changed a lot of things. It has brought in a lifestyle change. It has brought also aspirational changes. And as a result, you're seeing pregnancies which are getting delayed.
Right.
There are pregnancies that are coming with lifestyle problems. And there are also pregnancies that are coming after a long time of waiting for a pregnancy.
Right.
Like women have their own aspirations, they tend to postpone things in life, and then for rightly so, because we're adjusting to the new social order. So these are factors that contribute. When grandmothers come to us, they were hardly 16 or 17 when they got married.
That's true. The age factor.
And then they had children. They never had a respite from pregnancy. One pregnancy, second, fifth, 10th, 12th, like that they went.
Yeah, there was a history of a lot of deliveries.
So, you had. So the woman always saved her eggs. So she never found that the eggs were being used up. Because by the time she got out of the first pregnancy, she was again pregnant. So this has. Ladies now have got aspiration, there have been lifestyle changes, and as a result, what happens is pregnancies are getting delayed. Because pregnancies are getting delayed, they come with the necessary burden.
Right, makes sense. True, that's true. So do you think, as per lifestyle changes, right now, for example, at times even little younger women, for example, I would say a 28, 29 year is become like a bare minimum age for people to get married or have their first pregnancy. Lifestyle is the only factor, would you say, is
well, education has added to it, Previously there used to be child marriages, so they had their own social problems. But remember one thing, now not only has these changes come, there are a lot of things coming in, like for example, let's just say that sedentary lifestyle. Girls used to be very hardworking, you know. I remember my grandmother or my mother, she never got time to even rest during the day.
Right, true.
Now you see, now the day has become night for the ladies nowadays, and the night has become day. So people are working biological clocks have changed. So all these changes have brought in significant amount of attrition in the body itself.
Right.
So you have hormonal changes, you have using up of eggs over the time, And let us also face one more thing, that the girl is trying to discover herself. So, she is not only trying to, at the age of college, or, she wants a little bit of financial independence, and correctly so, because times have changed and, relationships have changed. And as a result, we are moving away from younger women having pregnant to older women having pregnant.
Okay. For example, like right now, if a person is planning for pregnancy, would be possibly the similar age group at this time, right now, what I'm saying, 30 years around. Is there any prevention they can plan pre-pregnancy so that they don't enter the zone of high-risk pregnancy? Because the big taboo about high-risk pregnancy, age-related ही होता है.
I think let's not keep age-related only thing. See, younger ones are facing metabolic problems. So metabolic lifestyle is the bigger thing rather than age I would go for. Now, there was nothing like a pre-pregnancy counseling for a grandmother or mother.
Right.
It has come in recently. Why has it come? Because again, the number of children people are having. If I remember, I asked my grandmother one day, how many children do you have? She says, you're talking about the living or the ones that also I lost.
Yeah.
So they keep account of that also. Now we cannot accept that socially or even scientifically.
Right.
No woman is going to say, I want to lose 3 pregnancies and have the 4th one correct. So each pregnancy is valuable, and each pregnancy has to be the best pregnancy for her. Okay. So as a result, we are moving into an era where we are going to do pre-pregnancy counseling. We'll advise them what is the factors that might push you into a certain amount of risk zone, or what you need to correct before you get into a healthy pregnancy.
Okay. So could you give us a brief on what basic changes, if a patient comes to you, what were the basic things you would advise them so that they don't, like in preconceptional time, that they can avoid?
See, when we were in medical school, that was many years ago, the average weight of our classmates in the girls was hardly 45. And we as boys were only 50 or 52. Now we are seeing a definite, when I go to medical college, I see no girl is less than 60. Yes. And they're easily going up to 100 kgs.
Right.
So you see obesity, and also the type of food that we are eating, they are causing more metabolic problems. So we become potentially diabetic. Diabetic incidence 40, 50 years ago in our population was less than 5%. Why has it come to 30%? It doesn't mean there's a vertical increase. It is also a horizontal increase. Where does this horizontal increase come from? It comes from the lifestyle change,
Right.
the stress that you're going through, and the type of work that you're doing, and the food that we are consuming.
Yeah, because even the consumption of food has now changed
Correct. It's been
drastically.
changed, So
Yes.
agreed that you are having better dietary things, so girls are getting better. But you see the incidence of anemia, which is a fair marker, I think, of what is the health style for the say, is yet continues to be in India about 60%. So 60 to 70% of the women, even in urban areas, are anemic, despite having a multitude of foods that are available in our diet. So something is going quite wrong.
Yeah. That makes sense completely. So for example, once the patient has conceived, a pregnant female, what are the signs can we guide them for or ask them to look out for? So for example, like giddiness, headache, as per your expertise, what signs they should look for, that they should consult their doctor thinking of checkup ke liye jana hai, or do you think that any test has to be done or included accordingly?
See, obviously, pre-pregnancy time only we screen them for a lot of endocrine problems, lot of things like diabetes and all that. But during early pregnancy, supposing she's already come to you pregnant, which are the red flags that you're going to see? First red flag is going to be the age, obviously. If she's going to be 30 plus, we're already flagging that thing. Now, because the 28 is the new 18. But egg-wise, it is the new 38, so you have to be very careful. A lot of eggs have got used up.
Right.
Then, of course, if she's consuming or taking any addictive things like coffee, say maybe even people smoke, they take a lot of alcohol, they even take, substances. So those things, history, we have to extract from them. Also, what is the family and societal support for her? Usually, we are seeing a lot of young couples coming, they're staying just together. They may be in a live-in relationship also, where she has got no support whatsoever.
Right.
So that is another thing we have to flag, Very important thing to. Then, of course, her education level, what she eats, what she chooses to do, what are the working hours, and now taking all this into factor, let's see now how she behaves. If she has got a weight which is more than, say, a BMI which is more than 30, that should again be a thing that we are looking at. Now, we're not seeing anybody with a BMI of 20 and less. Very seldom do we see them. So I think 20 to 30 is the new BMI which we should accept and go ahead. Then we're taking a good dietary history. Then we're looking at whether she's had any unusual bleeding or discharge, or there's a blood pressure change, or she's vomiting excessively, or she is having any other symptoms like headache which continues, or she is blurring. All these things go on to add to the high risk for the pregnancy.
So early pregnancy, these factors are to be very important.
Well, they continue into the later part of the thing also. Pregnancy, vomiting sometimes continues, and then that also you need to figure out whether she has some stomach infection, whether they have chronic acidity, whether diet is being taken correctly. Most of them don't want to reveal their substance abuse. So, you have to get into that history very often, that why you're taking late night coffees and things like that, so, or smoking, which is, they don't want to reveal it for whatever reason they want to. So all those things goes on.
So when the couple comes, when they're having a normal sonography routine, so at times even a radiologist or sonography say, this looks as going towards a high risk situation. So any findings or any tests which...
See, now, we are having the early pregnancy, of course, you can have it at 6 and 7 weeks to see whether it's got a viable pregnancy or not. But usually, along with all these markers that we do around 12 weeks, that's a very, very significant milestone in pregnancy, where we are looking at what the blood flow is, what is the size of the sac, how is the growth occurring, what are the biochemical markers that we are seeing, pregnancy proteins also. Then we are seeing the other proteins, and then we are finding a risk factor. There's a calculation over there, and then if she comes in the high risk zone, then we advise the other things. But looking at the mother or the fetus now, we are having more and more people who are doing fetal medicines. They are a good support to us for understanding what the baby is doing. Initially, baby was totally disregarded. Now we are looking at baby as a unit, and a very precious unit at that.
So that's a helpful modality.
It is an extremely supportive thing,
Because a lot of times, the elders come and be like, because you are screening so much, so you are
so
doing
that
a
is
lot
right,
of things.
So that is what, every woman is looking at 1 or maybe 2 pregnancies in her lifetime. So we want to give her and offer her the best, and she too also wants. Remember, pregnancy is perhaps the greatest investment as well as expense. You have to forget, all investments come with an expense.
True, sir, definitely.
So, Surya Hospital is one of the hospitals which is exclusively dedicated to mother and child. And we are hopefully going to be looking at this as a more of a synergy between the babe, the fetal unit and the mother, and subsequently the post-delivery, we are going to be looking at the support that we get from the pediatrician. Weeding out the high risk is very important, because now you have to understand, as a critical care expert, what is high risk and what is critical.
True.
High risks are those, which are not the usual run-of-the-mill that we see. They can have higher blood pressures, they can have lowered hemoglobin, you can have nutritional status, you can have obesity, but where does the flag come to critical things? When they start having a lot of things that can be, threatening to the life, the mother's life the moment it gets threatened, or subsequently the fetal life, this comes in the critical zone. This is what we need to identify, because let me tell you, we don't have God's hands that we can deliver everybody and very successfully take them to 100% success. So we need to identify these things, work as a team. It requires a multidisciplinary approach, and I'm sure we are going to get it at Surya Hospital, all this under.
Yes, that's true, sir. If, for example, when you pick a hospital for delivery, so if you have said somebody is a high-risk pregnancy, what all list of things they have to look for before picking their own hospital?
See, usually all, pregnancy should be treated as high risk. There's nothing, because they're just going in for a single pregnancy now,
Right.
So single pregnancy is going to be the most precious pregnancy. They should opt for a unit which is dedicated to mother and child, having all the
Right.
facilities. But the moment it becomes life-threatening, there are certain things like what are tertiary care center.
Right.
Now, tertiary care center can be called really Surya Hospital a tertiary care. Yes, it's the lower on the rung, but you have to have a dedicated ICU. You have to have a
Yes.
dedicated, a radiological unit. You have to have a huge support of the blood transfusion
Right.
protocols and all that. And you require a whole interdepartmental, synergy for managing these things. So maybe we are one step lower than the other big hospitals, but we can take almost successfully almost 99% to success. It is that 1% that can make the difference,
And even though I think pediatric team.
Yes,
makes
we have got a
lot
very
of
successful
difference. Yeah.
pediatric team, so I'm sure we can give the neonatal care, very, very good neonatal care. But remember one thing, we read in papers, so many people died in a road accident, or some in tunnel collapse, or somebody got washed away. They become mere statistics. But when one mother dies, she's not statistics anymore. It's tragedy.
Right. So when a pregnant female or the couple hears the word that they are coming under the high risk pregnancy category, they get very scared that something might be wrong with them or the baby. At that point, how do you reassure the patient?
See, let's not run away from the fact that high risk involves the mother and the child. It does involve. They have to be clearly spelled out to them. But how do you allay the fear?
Right.
See, when you sit on a flight, now we're having turbulent times, we're having war, so the pilot takes you. So who's the responsible person? The responsibility is of the doctor. So you have to assure them that we'll handhold you.
Yes.
We'll assure them that you have to follow the do's and don'ts that we tell you to do. So there is also a thing we have to give reassurance that from high risk you can come down to a low risk if you follow some of the things. But supposing she has, let's say, a heart problem, which cannot be changed now.
Right.
Blood pressures can be controlled, diabetes can be controlled, but certain things cannot be controlled. In that event, you have to tell them that we'll be doing a lot of hand-holding for you, and we are the ones, we are being paid for that. So we will be giving you assurance. We'll also be telling you when things are getting out of hand.
Right.
So you have to visit us very, very regularly, and you have to follow all the things to the T as we tell you.
That's true. So there's even a thing that once you say it's a high risk pregnancy, they automatically believe that I have to go on bed rest.
No.
That's a thing that अभी डॉक्टर ने बोला high risk pregnancy है, so they just immediately go on. I need to have a bed rest throughout the pregnancy. Is that
so
true?
It's the moment the age. Let's say take for an example age 35 plus. So she is coming to the high risk zone.
Right.
So zone again is how
Very
bad is
good.
this thing.
Right.
So it's like a temperature bath. You can tolerate 35 degrees, but you cannot tolerate 40 degrees.
Yes.
So you have a range. So you have to understand which in this high risk is sizzling hot.
Right.
So in the sizzling hot, you have to follow the do's and don'ts. But when it's in the warm zone, you always tell that there's a thing that you can climb down by following whatever prescription, by following whatever we tell you to do. It's very important. Like, see, now the baby is not growing, let's say for this thing. You can't do overnight magic, but you can bring principally some amount of rest, a good protein diet, maybe some medication along with it to improve the baby's health conditions, But then, nothing works as magic.
So it doesn't have to be a bed rest is equal to
bed rest is, see, when we were students, one of the cornerstone of treatment was bed rest.
Right.
We are looking at growth restricted babies, one of the cornerstone. But now we are finding that you can even domiciliary treatment for hypertension. You advise the right amount of drugs. They take it. They monitor. Self-monitoring was very poor previously. Now self-monitoring has become very, very easy also. And somebody or the other also done now doorstep deliveries are there. So people come to your house and check your blood pressures and all that. So you can technically take, say, bed rest as not in lying in bed, but staying at home for sure.
Yes. So these days, do you think that the mortality rate of female during the pregnancy has increased or decreased according to you? Moreover, with the new technologies, testings from the doctor's side, and even to the Google aspect, the patient goes to Google online information. Has all of these new technologies and information has changed the rate of patients' well-being?
See, I'll flag one thing. There is no cure for Google. So that's where I want to first tell you, you follow your doctor's advice. Yes, of course, we are going to be giving you repeated updates on information and where to get it. Take it from the proper, But as you come for maternal mortality, this is one of the things that deeply, it's an article of faith for me, Saving mothers' lives is probably what I've been fighting for all these 45 years of my life, So when we were students, maternal mortality was around 700 plus in India for 1,000 1 lakh live births. Now it has been substantially dropping, and we have gone, in India itself, we have gone well below the 100 mark. So there has been significant strides. Now, who has contributed? Let us try to understand. It requires a lot of backing. If you see Western countries, or if you see places like Vietnam or Sri Lanka or something, it is government initiative. So government is very, very responsible to educate people in how to go about your deliveries. Second, it is the information what we pass on to the patient and how she responds to it, so that we tell them that you come back, you come for an antenatal checkup. Now, initially, about 50 years ago, hardly 30 to 40% were taking good antenatal care. Now antenatal care have penetrated to almost 95%. So once antenatal care comes in, your mortality comes down. Then very important to have a qualified birthing specialist who's going to be doing the deliveries. That also helps out. Identifying the high risk, timely referral, and helping in the referral always matters to bring down mortality. However, like I told you at the start, that roads are going to be bumpy, potholes are going to come. We do not know which thing is going to get us into trouble.
True.
A lot of God's help, a lot of good luck also matters, besides a doctor struggling to get you to the right side of the zone, from red to green. It's very important. And I'm proud to tell you that we are now in Maharashtra. Of course, the lowest mortality is happening in Kerala. We are followed by Tamil Nadu and Maharashtra. We have reached almost 30, which is quite much the same. But we have burdens and laggards like Orissa, Assam, Bihar. They are causing, the mortality rate to be hovering around 80 to 85 yet in our country.
So the new technologies, also the testing, and has helped a lot in this aspect.
Well, even the basic things, if you extend, newer things, yes, they improve the outcomes.
Yes.
Maternal mortality, to have technology definitely has made a lot of difference, access to medical help also, and more important, blood. Blood was given as water before, but now we are giving it as precious components. So component therapy in the last 30 years have changed the picture in patients who bleed and require blood. So maternal mortality, one more reason that has come down is that.
Selective
yes, you give.
What would be your going away message for all the pregnant ladies who are expecting or planning for pregnancy, or for women who have been told it's a high-risk pregnancy? What would be your go-to message to them?
I would tell them, have pregnancy on their regular time, which you're supposed to have it. For those people who are postponing pregnancy, you should freeze your eggs, consult your fertility specialist in doing so. Get your metabolism in order, your all medical defects in the same. Get a good social system in place to help you through pregnancy. Very important is trust your doctors and not Google. And more importantly, be a regular checkup.
Close monitoring.
Close monitoring, so that we can identify the high risk and then weed them out and give them special attention to those people who will require them.
Thank you, sir. Thank you so much. It's a very, very informative session, and obviously your experience and expertise has helped a lot to understand the high risk myths and facts which are to be followed.
As we go on in life, you suddenly realize how many buses and things we have missed. So very important to tell people that stay aware. Even I will tell my doctor colleagues, please flag the high risk and then send them to appropriate people, authorities who can handle them better, so that we can have better medical outcome.
So these days the hustle culture, also the fact that the couple is just staying alone, tend to see that such stressful environment also makes a difference and can cause high risk pregnancies. Do you think it has a major impact on the couple and the pregnancy?
Without a word of doubt, loneliness is what is causing depression. Now, very often the woman who's, she's the one who has to multitask. She has to care for the pregnancy, she has to care for the home, she has to care for her office role. So when she's balancing all this, she finds it a huge challenge, And I'm glad the government is now offering them more and more, help during their pregnancy and the post-delivery. But more needs to get done. Now, when she comes home, she finds the husband has not yet returned. There's no one who can give her food on the table. There's nobody who can listen to her for the problems that she has faced during the day. So I think we need to get back to a system where there's a lot of support from the immediate family. Somebody must come and help them out. I also am aware that the senior generations are yet working and they find themselves useful. But let us all understand, as grandparents or aunties and uncles, we are nurturing a future generation which is going to be, single.
Right.
So we need to give a lot of attention from this. Supposing the patient, person is unable to get people, then I think a lot of video calls do help to the mothers or to the immediate family, friends or things like that to overcome these things. But nutrition is always a challenge for a working woman who comes back and finds that she's alone at home.
True.
So these two things, loneliness and nutrition, should be dealt with.
So like usually people say, taking care of a baby takes a village. So even taking care of a pregnant woman kind of takes a village to deal with the pregnancy.
I would agree, and I would tell you that I worked as a professor in Fiji. Now, Fiji doesn't have any marriage system, legal marriage system.
Okay.
So they have something called as a partner system, where she doesn't even know who is the father of the child quite often. But who cares for them? It's the family, the immediate family. The ladies of the family take complete control of the pregnancy. They also take complete control when the baby is born.
Right.
So you see that despite of having such a challenge like this, they overcome their burdens. Right. Mortality rates are low, the cesarean section rate is low, as well as postpartum depression is quite low in this society. So it is ultimately the support system that covers a lot of things and matters a lot.
Mentally, physically and emotionally, the support is very important.
Absolutely.
Makes sense, and definitely. I think that is a very good takeaway, especially for young couples, because it's become a trend now.
Yes, to stay separate.
Just stay separately and to do everything on their own, because it feels like a responsibility. I have to do everything. So I think it's okay to just call for help when you're in that stage.
Being hands-on parents is one thing, but to have support for when you're lonely, when you're depressed, or in a corner, we don't know how to handle the situation. You definitely need help.
Yes. Thank you, sir. Thank you so much. So thank you, viewers, for watching this episode with Dr. JP Rath, sir. We have had an amazing, interesting and very informative knowledge regarding high-risk pregnancy. Hoping to have cleared few of your doubts and making your pregnancy journey a little easier with this conversation. I am Dr. Shweta Jain, and I hope you like this video and it is helpful.